The health sector has been hit hard by brain drain, which began during the country's economic problems. So the government says the increase, which affects private institutions, is aimed at paying doctors better to keep them within its borders. Medical aid societies, whose clients make up the bulk of private hospital patients, fear the increase could wipe out their coffers as they are yet to raise their member subscriptions, a claim the health ministry says is unfair.
From the time that we dollarized to the time that we are now, which is 5 years later, already the medical aid societies have increased their fees 4 times. And without a corresponding increase to hospitals, to service providers like doctors, like labs, but they have been collecting the money.
But it's only 1% of the population that is covered by medical insurance. What will happen to the bulk of people who have to pay in cash? This woman has a heart condition that requires monthly checkups and replenishment of medication. She tells me that it's been getting harder to keep up with the costs. Irene Chiwayo and her 2 children live in the care of her mother and sister, and they're already buckling under a mountain of debt from medical bills that date back for almost a decade. Any increase in medical fees could push this family beyond the brink. In the same neighborhood, I met a stroke victim in a similar predicament.
Before the increase, we were already finding the going hard, so now things will just get worse. We will end up just staying home even when we are sick because we can't afford the fees.
Ideally, Changerai and Irene should be receiving cheaper care at public hospitals, but they say they are understaffed and short of drugs, which is why they end up going to the private ones.
Sometimes they are correct. The service is poor. As a ministry, that's one of the things that we are focusing on. That when you go to a public institution, you get a service and you get a high quality service.
One sure way of achieving that is keeping the best doctors in those institutions, which government says can only happen if they are paid well enough to resist the temptation of seeking greener pastures. Farai Mwakutuya, CCTV, Harare, Zimbabwe.